So today's test is about estimation of fibrinogen levels. Estimation of fibrinogen levels. So what is the use of fibrinogen? Can you tell me? It will clot the blood, right? So fibrinogen involves in clotting of blood. So I will quickly write the coagulation pathway here. So what happens immediately if you have a blood vessel damage, intrinsic pathway will be initiated. If you have some tissue damage, so tissue damage happen, so that leads to extrinsic pathway activation, right? So both these pathways will make a common product. That product will be prothrombin activator. Prothrombin activator. So prothrombin activator will convert prothrombin to thrombin, and this thrombin will convert our fibrinogen to fibrin, and fibrin will cause the clotting of the blood. Blood will be clotted. Clear, right? So yes. So fibrinogen, fibrin, thrombin. Yeah. Now, if we want to study the fibrinogen activity, if we want to study the levels of fibrinogen, what will be the activator? So obviously first we are taking platelet pooled plasma for this sample. Am I correct? So we took this sample in a test tube, right? So obviously it is an anticoagulator, separated platelet pooled plasma. So this is an anticoagulator blood. In this I need to add an activator. Add an activator to initiate fibrinogen conversion to fibrin. What activator I can use? I will use thrombin as an activator. Got my point? Why I am using thrombin for fibrinogen studies? Because thrombin is the activator of fibrinogen. That's why we are using activator, that is thrombin. Now, there is a simple rule. This rule was at increased thrombin concentration and reduced fibrinogen concentration, it is directly proportional to thrombin time. What is this? Thrombin time is directly proportional to thrombin concentration and decreased fibrinogen concentration. I will let you know. Let us assume patient has less fibrinogen levels. The normal fibrinogen levels write down. In grams, this is 2 to 4 grams per liter. In milligrams, 200 to 400 milligrams per liter. This is the normal fibrinogen levels. Normal fibrinogen levels are 2 to 4 or 200 to 400 milligrams. Right? Keep in mind, fibrinogen was secreted by liver. Liver is the primary organ that will secrete or that will synthesize SI, ZD or anyway. Liver will synthesize fibrinogen. Okay. Let us assume patient has a hepatitis A or B infection, even C infection. Or he is severely alcoholic. In this condition, his liver was damaged. Liver damaged. So protein that is synthesized by liver is fibrinogen. So fibrinogen levels might be reduced. This is one criteria where fibrinogen levels can be reduced in the plasma. In plasma, fibrinogen levels reduced because of liver problem. If that is the case, directly we can detect the patient if the patient has a liver issue. Definitely he will have jaundice. Am I correct? Definitely he will show jaundice symptoms like yellow discoloration of skin, eyes, liver, stomach pain, swelling of the abdomen. So typical indigestion, typical jaundice symptoms. So this is one criteria. Then other criteria. What is other criteria that reduced plasma fibrinogen levels. That I will discuss. Just stay here. I need to finish this concept, right? Yeah, I was moving here. Yeah. Now the idea was reduced fibrinogen levels. At reduced levels, and I have increased thrombin time. Automatically thrombin levels looks like increased. If you see the ratio, now the fibrinogen levels reduced, that indicates thrombin levels might be increased. Or they are normal, but the ratio was altered. I will give one example. Ratio was 50:50. Since it is reduced, it looks like a 10:50. It looks like thrombin was increased. Got my point? Okay. So that is the idea. So increased concentration and decreased fibrinogen levels is directly proportional to thrombin time. So I was measuring the thrombin time to indirectly measure the fibrinogen levels in the blood. You got my point? How I was using thrombin time to measure the fibrinogen levels. Usually thrombin time should be normal in case of normal condition. But when there is a less fibrinogen, the thrombin time will shoot up. Because its concentration increased, relatively speaking to fibrinogen. This is the principle. Okay. This test is a quantitative test, not a qualitative test. I can understand. Can you tell me the difference between qualitative versus quantitative? What is qualitative and quantitative? Give me a simplest definition.
Checking the presence. In qualitative, we are checking presence.
Very good. In qualitative, we will just check whether it is present or absent. That's it. It is present or absent. But we cannot measure the levels of that presence thing. If you, okay, say for example, in qualitative, I came to know patient has fibrinogen. Now I need to measure the levels of fibrinogen. That will be possible in quantitative analysis. Levels of fibrinogen can be studied in quantitative. Hence, this is a quantitative test. Okay, and this principle where we are using thrombin as an indirect measurement to measure the fibrinogen, this test is called as Claus test. There is a scientist named Claus. So we are using something called Claus test to identify fibrinogen levels in the body. Got it? Any doubts so far? Right? So this method of measuring the thrombin time accurately in order to understand fibrinogen levels is called as Claus test. Okay? And you have understood the concept also. Yes, Mrs. Z? Directly proportional to? Fibrin is low. Correct. Yeah. If thrombin time was increased, that means fibrinogen levels were decreased. Okay, that's why thrombin time shoot up. This test is particularly measuring low fibrinogen levels. Keep in mind, this test was particularly targeting low fibrinogen levels in the body. So you might ask me a question: what if thrombin time reduced? Is that mean increased fibrinogen? That is different story. The reason for that is a different story. For that, we will just take thrombin time. We are not correlating it. No, we will add it. We will purposely add from the outside. A known concentration will be added, which is not available in the plasma because this is secreted. I already qualified thrombin. In order to measure the thrombin in this patient, I will use prothrombin as an activator. If I want to measure thrombin in the patient sample, I will use prothrombin as an activator. So you are asking, you repeat it and let me answer. Yeah, for that purpose, you need to understand intrinsic or extrinsic pathways. Thrombin itself is dependent on prothrombin. You need to measure prothrombin issues. either this clotting factor issues or this clotting factor issues. These two factor issues will lead to this prothrombin to thrombin conversion. What it? These issues will be studied here. Okay. So you want to understand the efficiency of thrombin in conversion of fibrinogen to fibrin. Okay. Yes, listen. Thrombin has a standard conversion rate. So you want to study the rate of conversion of thrombin. Rate of conversion of thrombin. You know, that will be a different story. There we will use a serially diluted samples and we will plot a why in the world thrombin won't convert fibrinogen? If there are any issue with such thrombin, definitely we will identify that in the CT will be elevated and definitely APPP will be elevated and the PT or everything will be elevated. PT will be elevated, this will be elevated. I need to check with PT. PT will be decreased. PT will be decreased. In case of thrombin issue, the thrombin time will be reduced. Reduced thrombin time indicates an issue with the conversion of thrombin, fibrinogen conversion by thrombin. So TT will be useful in that case. Got it? Yeah. Okay. You can ask critical questions later because it is creative. We'll see. Anyway, overall efficiency can be checked by TGT. So all values are equally important. Got my point? Have anyone understood what is Muskan's issue? Have you understood yourself? TT can be directly, yeah, I understood. Serially dilution should be done. We'll see later. Wait. Let me finish my topic. Yeah. We'll work on it later. Where am I? Fibrinogen. Last test. Decreased fibrinogen directly proportional to increased thrombin time. We understood their relation. Next thing, one reason for reduced fibrinogen levels will be liver problem. Liver problem will reduce fibrinogen levels. This is not our concern. Liver problem can be detected by biochemistry test. What is our actual concern? I will discuss. See here. Let us assume he has a healthy liver. That means liver producing sufficient 4 grams of fibrinogen. So liver producing proper fibrinogen, but still plasma fibrinogen, blood vessel, okay? Plasma fibrinogen level is reduced. Why? When the liver is good, still my plasma fibrinogen levels are reduced. This is the primary concern. What my point? If liver was healthy, liver must produce a normal fibrinogen levels. But why my plasma, when I am detecting why my plasma fibrinogen levels are reduced? Got it? So we need to work on it. The reason is, listen, this clot will be removed by a mechanism, if you remember. That is called as fibrinolytic mechanism. In fibrinolytic mechanism, what happening? There is something called plasmin, a scissor molecule we can say. So plasmin will cut the fibrin. It will cut the clots. Am I correct? So it will cut the clots, leading to 2 types of release into the circulation: FDPs, fibrin degraded products, and D-dimer molecules. D-dimers. D-dimers are the small protein residual components released from the degraded fibrin products. Very simple. Fibrin clotted. That clotted fibrin was cutted. It was lysed. The clot was lysed. Maybe I will say like this, then you understand. This is a clotted material. Now, body removing these clots. If we are not removing these clots, if I am not shredding this into small pieces, this paper might choke in my nasal pathway, right? I might get choking. Similarly here, the blood vessel might block. These clots will block the blood vessel leading to ischemia. It can cause ischemic heart attack. If these clots are multiple in the body, let us see. If there are multiple clots in the body, that condition is called as DIC. During DIC, what happens? The levels of plasmin will be shoot up. Body will increase plasmin levels because there is a huge clotting ongoing in the body and it is destroying the clotting. Right? During this process, what happens? Plasmin removing the clots. This is one story. And let us see the fibrinogen levels. What happens to the fibrinogen levels? Will they increase or will they reduce? Fibrinogen was converting to fibrin. Fibrinogen was converted to clot. Right? So fibrin levels will be reduced. Fibrinogen levels will be reduced in severe DIC condition. In severe multiple clot condition, the fibrinogen levels will be reduced because fibrinogen was converted to fibrin. What my point? Since fibrinogen utilized as a fibrin, the levels of fibrinogen was reduced in the plasma. So if we detect reduced fibrinogen levels, that is a very serious concern, serious issue in the body. Might be patient suffering with multiple clots in the body. That is not at all a good sign. Okay. Recently, I think yesterday or day before yesterday, I kept a case study. If you're following that YouTube, I was keeping one case study every day. Right? I kept a case study on snake bite. Most of the snake venoms, they will clot the blood. They will clot the blood actually. So if we get a patient with a snake bite, the immediate lab test we will perform will be coagulation profile. CT, BT, ABDT, TT, TGTs. We want to see how much of his blood was clotted. What is the severity of the clot in the body? Got my point? The same reason, when the snake bited, your blood will clot in the lungs. Let us assume blood in the lung clotted. So what happens in the lung? There is a pleural fluid and there is something called surfactant. Surfactant is a lubricant present in the lungs. Between two pleural layers of the lung, there is a surfactant that will lubricate the lungs because lungs are expanding and contracting, right? So during this time, this surfactant will cause froth formation. Froth. This surfactant, that froth. You understood that? Froth. So during this friction, let us assume the blood clotted between pleural cavity and there is no proper exchange of fluid leading to excessive froth formation and this froth will be started expelling out by the snake bite individual. Now you understood, right? In the movies they will show after snake bite they are coughing out froth, some froth, right? The reason was this ongoing clotting of blood in the body, a severe clot, not a normal clot. Entire blood in the body was clotting due to snake venom. So the conclusion was, even in snake bites, the blood will clot and fibrinogen levels will be drastically reduced. Got my point? So we will monitor these levels in order to monitor the patient health status. Okay? So that's it. This is all about the significance of fibrinogen level estimation with the help of thrombin as an actuator by a test called clot test. Okay, and what is the normal fibrinogen levels? 200 to 400 milligrams or 2 to 4 grams per liter. And who will secrete fibrinogen? Liver. And very good. So in case of DIC or excessive clotting condition in the body such as heart strokes, what will be the levels of fibrinogen? It will reduce. The reason? For conversion into fibrinogen due to clots, right? So there is a particular term for this coagulopathies. They will say them as a coagulopathies. DIC conditions are called as coagulopathies. Coagulopathies means coagulation disorders. Pathy means pathology, study of disorder, disease. Clotting diseases. Clotting diseases. Now, by the way, the best methods to identify this one will be ELISA. We know that ELISA is one of the best methods for quantitative analysis, or we can do protein separation by chromatographic techniques where we can separate the fibrinogen properly, or we have other methods like chromogen techniques. Chromogen technique again ELISA based, okay? And we can also use RAA, radioimmunoassay. Okay. When we have a very good methods in the biochemistry, why we are using clot test? Any ideas? Clot test is a very indirect method of measuring this one, right? Rather than measuring the fibrinogen directly, we are using thrombin type to indirectly estimate. Why we are using this method? Any idea? Just to torture. Easy, cheap and effective technique. You know the thumb rule, right? Always we will go with a simple test first. If I say ELISA test to 6,000 to the patient, he can't do it. So, cheap and easy is the first priority in medicine, in healthcare actually, keep in mind. Gold standard method. Ideally, gold standard method will be this, but we can also use a class test. They are saying that class test was standardized to get these values. So we can base our results on class, but always there will be differential diagnosis and confirmation. Always we will do it. If class test came negative results, positive results, if we get a very increased thrombin time activity, definitely we must measure fibrinogen with the test. Okay, we cannot rule out with a single test actually. Anyways, yeah. So now you know what are fibrin degrading products. Now listen. There are other measures. What if fibrinogen levels are normal? What if thrombin time is normal? Sometimes this happens. So what the body will do? It will do negative loop. Since fibrinogen levels reduced, it will make the liver to pump more. Okay, it will make the liver to produce more fibrinogen. But that requires 2 to 3 days. What if the patient coming after 2 to 3 days? When the liver started its loop, negative loop activities. At that time, again we will miss the condition. We will miss the DIC condition in the body. Got my point? Just like bone marrow, when there is hemolysis, bone marrow activity rate increased. Here liver activity might increase in healthy individual conditions. What to do in that condition? So yes, this can give a false negative results. Class test is prone to false negative results. Even though there is a ongoing DIC, we cannot rely on class test. To further confirm that, we must measure D-dimer and FDPs. Fibrin degrading products. There is a separate test for FDP measuring and there is a separate test for D-dimer test. So we are relying on multiple tests. So by this, my conclusion was, in studying bleeding disorders, not only CT, BT, MPT, TGT, we also need to measure fibrinogen. Also, we need to measure vitamin K levels. We need to measure D-dimer levels. We need to measure FDP levels. And also, we need to measure finally the nutritional components. Nutritional components means vitamins, etc. that are involving these mechanisms. Clear? Any more doubts in this topic? So you need to systematically put together everything, then you will understand this concept. You need to understand the basics first, and you will understand the depth. Oh, Muskan not left me. Wait. Wait.